Hypertension, in a common man's word, can be described as a person who's having elevated BP readings of systolic blood pressure of greater than 140. That is, a person has normally two BP readings. One is defined as systolic, and the other one is called diastolic. When a patient has systolic reading of 140 and a diastolic reading of greater than 100, the patient is known to be or detected to be having hypertension. And any reading of late, we are telling that any patient who has a blood pressure reading of greater than 130 millimeters of mercury, the upper reading, which is also termed as systolic, also can be described as, can be labeled as a hypertensive, and diastolic reading of greater than 90 millimeters of mercury also can be labeled as a hypertensive patient. In majority of the circumstances, a patient who has been started on antihypertensives are the drugs which are used to treat hypertension. Majority of them, around 80 to 85% of the patients, have to be on antihypertensives lifelong, while relatively a smaller fraction, constituting to around 15 to 20%, the doses of antihypertensives can be changed or they can be decreased. And if a patient can follow strict diet protocol, in the sense that you can avoid few medicines, avoid few foods, and quit smoking and alcohol completely, not decreasing the quantity, quitting completely. Hypertension, please remember, it is also one of the risk factors for heart attack. So if a patient has hypertension, it directly puts him under the risk category for having a heart attack or a brain stroke. The major culprit can be probably considered to be smoking, alcohol, late night working hours, uh, lack of physical activity, and eating excessively, thereby contributing to obesity. And definitely, family history also will play a significant role in contributing to hypertension. But there are few modifiable risk factors which can be